and start with the session. Over to you, ma'am.
Thank you, Dr. Neha. Thank you so much. And first of all, I'd like to welcome you all, and I would like to thank Symbiosis SSODL for providing me this opportunity to present this webinar today. So without wasting much time, we'll start. I'll just share my screen. Right? Is my screen visible?
Yes, it's visible.
So today we'll be talking about mental health. Why mental health is important? Why should we having awareness about it? And of course, I'll be introducing you to a very new topic, that is perinatal mental health. So let's start with health. So what is health? The health, as by if we go by definition, health is physical, mental, and social well-being, right? So physical health plus mental health will be giving you a happy life. So we all are quite worried, or we take care of our physical health quite well, but mental health, of course, in our country is ignored. Still, there is lots and lots of stigma associated with mental health. So today I'm here to break this stigma and to make you aware about mental health. So what is mental health? It is an emotional, psychological, and social well-being. Basically, it is how you feel, how you act, how you deal with the situation in a stressful situation, how you are acting, how you are taking healthy decisions in your life. That all comprises of your mental health, and it is equally important for all age groups like your physical health. So, what is mental illness? Mental illness is any disorder because of which a person is not behaving in the manner he should be behaving. He is not behaving as per the social norms. He may have altered mood pattern. He was behaving normally earlier, but suddenly you find that he has altered mood, his pattern of thinking, his behavior is changing. All this leads to mental illness. So before going into causes, types, and everything, I'll just share why should we talking about mental health. What is the global and Indian data about mental health? So 1 in every 5 individuals suffer from some sort of mental health symptoms globally. And 970 million people around the world are struggling with mental illness. They need some sort of treatment for their mental health. And very interestingly, if you'll see this line, 50% of the mental health conditions begin by the age of 14 years. At the age of 14 years, you have developed certain sorts of mental health conditions. And by the time you reach 24 years, 75% of the conditions have developed. So, if you know about mental health, if you know about mental illnesses, it will be easier to diagnose it early. And the early you diagnose, the more chances of getting it fully cured will be, right? And of course, an alarming data, 14.3% of deaths worldwide, that is approximately 8 million deaths every year, they are attributable to mental health disorders. So it's a big figure. So what is the state of mental health in our country, in India? More than 60 to 70 million people across India are in need of mental health care. They need some sort of mental health care, but 70 to 92% fail to receive treatment. There are various causes. We'll talk about it. 1 in 20 people suffers from depression alone. Depression is the major mental illness which we Indians are facing nowadays. According to research, India only accounts for 30% of the world's depression, addictions, and suicides. So India has a major role to play in the mental illnesses. And what about our mental health care specialist ratio in our country? We have only 0.3% psychiatrists for 1 lakh people in our country. Whereas in developed country, it is 6.6 psychiatrists for every 1 lakh population. So there is a big gap. Again, we have only 0.07 psychologists for 1 lakh people. So one reason why people are not able to approach mental health because of accessibility, because of extreme shortage of mental health care professionals. And there was an economic survey which said India will be losing $1.24 trillion between the year 2012 to 2030 because of mental illnesses. Why so? Because of mental illnesses, our work productivity decreases. So we are going to lose such a huge amount, which is a big economic loss for our country. Now, this slide shows the most prevalent illnesses in our country. As I said, depression is on the top, followed by anxiety, drug abuse, alcohol abuse, and other mental health disorders. And the second slide just shows the state-wise distribution of disorders which are prevalent in each state. Like Tamil Nadu, you will find more of depression. Kerala, you will find more of anxiety disorders, and so on. Now, again, this is very alarming. India is known as the world's suicide capital. We have 2.6 lakhs cases of suicides every year. And if you go by the data of WHO, that is World Health Organization, average suicide rate in India is 10.9 for every lakh people. So for every 1 lakh people, we have 10.9 deaths each year. And what men, of course, men are more prone to suicides than women. The rate of men suicides is higher in our country as compared to women. So what are the causes? This slide shows the causes of men committing suicide in our country. So it is mental illness, love affairs, financial issues, drug, alcohol, and career problems. If you go by me, love affair, financial issue, and career problem, these three things ultimately leads to some sort of mental illness. Like if you have a breakup, you finally land up into depression, and it is because of depression that one commits suicide, right? And then another problem is drug and alcohol abuse, which hampers the way you think. That's why you end up in committing suicide. Now, if it is so, the data is so alarming, but why people are not wanting to talk about mental health? Why is it so? Because there are many things. As I said, stigma associated with mental health. In our country, what happens? If I talk in common slang of a country, we call a orthopedician हड्डियों का doctor, a dentist दांतों का doctor. What is a psychiatrist known as? पागलों का doctor, right? So if you go to a psychiatrist, that means you are pagal. That is the thinking of a country. Most of the people think, अरे हमें कोई पागलपन की बीमारी थोड़ी है. So you have fear of being labeled or judged. People will say, oh, you have gone mad, that's why you're going to a psychiatrist, right? Then there is fear of rejection. People will come to know, oh, he is going to psychiatrist means there is some issue with his mental health. Okay, he's not fit for my job. Let me remove him from the job. Oh, people will pity on you. He has got some mental health issue, right? So there are rejections. Your partners, your girlfriend may reject you. You are going to mental health professional means you have some problem. Oh, I don't want to be with you, right? So there is fear of rejection. Then there are certain people who think that it's only in your mind, and if you talk about it, it will become real. So let's not talk about it. Then fear of being misunderstood. See, every person cannot understand what you are saying, especially if it is regarding to mental health illness. There is a situation in mental illness that is hypersexuality. A person is hypersexual, he himself knows he wants to control it, but he keeps getting thoughts. So what should he do? If he'll talk to somebody, no one will understand. They will mislabel him. But what happens if he goes to a therapist and talks to him? We can find out there are generally people who have faced childhood sexual abuse. They become hypersexual when they grow up. So we can treat it with therapy, right? But everybody cannot understand. If we will talk too much about sex, then people will mislabel you, right? So there is fear of being misunderstood. Now there are people who think, why to worry others because of my problems? I am having problem. Let it be with myself. Why should I burden other people about it? Then of course you have difficulty in opening up about vulnerable topics. You don't want to talk or share your every part of life with everybody. So it's completely fine. But if that thing is creating problems in your life, you should go ahead and share with someone. Then in certain cultures and society, you're not supposed to talk about mental health issues or all these issues, especially men. Men, they are considered they should be strong, emotionally strong, physically strong, and they should be able to handle all the emotions, right? So they should not be talking about it. Then you have worries that people will see you as weak. Again, it's more for men. If you see, if a man cries, what we say, Arey, he's a man, he's crying, he's weak, he's emotionally very weak. It's not acceptable, right? Then feeling ashamed. You may have done something out of ignorance which you are ashamed of now. So you will not be like to talk about it because you are ashamed and you will feel that the person listening to you, he will judge you according to that. So you don't want to talk about it. Then one last thing, you have opened up to someone. You wanted to talk and you have talked with someone, but then he has not understood you. He has misjudged you. He has not given you proper context. So you shut down and you don't talk about it. So these are the reasons why we don't talk about our mental health. Again, one more thing we don't talk about is it is we cannot see mental health, right? If we have a skin rash, we can see, oh, we have got a skin rash, we'll apply some ointment. If we have a broken leg, we will have pain, we will have swelling, so we'll go to a doctor, he'll see, he will get an x-ray, oh, your leg is broken, he will fix it, right? But what about depression, anxiety? We are feeling sad, we said, okay, it's a phase, it will go away. But we don't realize that this sadness, depression is continuing for months now. So now is the time we should go for a therapist. Again, this slide where there is two girls. See, this girl is seeing completely fine from outside. She is creative, she is doing well, she is happy, extrovert, and she laughs out a lot. So you cannot make out what is going inside her, right? Inside her, she's anxious. She cries when she's alone. She has negative thoughts. She may have thoughts of committing suicides, right? So you cannot make out. Only you can know what is the status inside you. And you are the best person to decide for yourself when you can control it on your own or when you need a therapist. Other people who are around you will only come to notice when these things will start affecting your day to day life. They will see, oh, there is some change, she's sad. In so many days, I'm seeing she's continuously sad, or I find her crying whenever I go to her room. So only they will see only when it has started manifesting outside in your day to day life. When it starts inside you, you are the best person to diagnose it. So you should be knowing about your mental health and you should be taking care of your mental health. Now, this brings to what are the types of mental disorders. So DSM-5 has made a big list of mental health disorders, but I have just put down the importance which we'll be discussing in short. First is depressive disorders, that is depression. When you are continuously sad for more than 2 weeks, you are crying, you want to stay alone, you are not sleeping properly, or you are sleeping too much, you are not eating properly, or you are eating too much. You don't want to be around your family, your friends, your people. You don't want to talk about anything. You may close yourself in a room and you'll just sit or lie down and you will not do anything. That is depression. Then bipolar disorders. And what happens in bipolar disorder? You have shift of mood and energy. What happens? There is maniac stage. In maniac stage, you're too happy, too hyper excited. You will keep on doing things. You will keep on talking. You will not get tired. You will be restless, so restless whole day. You will day and night also. You may not sleep properly. You'll just keep on doing one thing, other thing, other thing, other thing. Now that was maniac stage. When the depression stage comes, what will happen? You will close yourself in a room. You will not go out. You will not do anything. You will just sit in one corner and keep crying, crying, crying. So exactly opposite of the maniac stage. So that is bipolar disorder. Then comes anxiety disorders. We all have anxiety at certain points of time. Like before exam, we are anxious, right? So some sort of anxiety, small amount of stress is okay for our life, but it should not be such that we are not able to handle it. What happens in anxiety? There are various types of anxiety, like panic disorders, wherein you are so anxious, so fear, so much worried about a situation that your heart starts pounding. It starts beating very fast. You start feeling breathless, as if you are not getting air, right? So that is panic disorder. Then there is separation anxiety disorder. It is most common in small children. They don't want to go away from their parents, so they keep cry. They will do all they will throw tantrums, but they will not leave their parents, right? Then there are phobias. Many people have phobias. Some are having phobias of spider, closed space, height. All these comes under anxiety disorder. Then personality disorder. Now, a personality defines a person, right? How you feel, behave, act. That is you, and that is you as a person. That is your personality. Now, in what happens in personality disorder, there are various types of personality disorders. One is like antisocial personality. So, what are they? They will do anything which is against the society norms. They will commit crime, they will murder, they will rape, they will do anything, and they don't feel guilt, or they don't feel a shame or in doing so. They like doing such things. So they are antisocial personality. Then there are certain people who want to be center of attraction all the time. So they will do anything to gain your attention. Any sort of drama they will create to gain your attention. Then there are certain people who wants to be looked after, who wants to depend on one person in their life. So they will do anything, whatever he says, they will do. He will beat, he will misbehave. He then also they will tolerate it, but they want that person to take care of them. So there are different types of personality disorders also. Then sleep wake disorder. Of course, there is disruption in the pattern of your sleeping and your getting up. You may sleep during daytime, you may not get sleeping in the night time. So it generally comes with other type of disorders. Eating disorders. It's very common in our country, and especially in you can say adolescence. See, and there is a certain this thing like our Bollywood actors. Our heroines have to be zero figure to look good, to get good work, right? And what our youth is doing, they make them their idols, and they also want figures like them. So what they do, they don't eat properly. They are malnourished, and certain people who don't control their eating, what they do immediately after eating, they'll go and they will make themselves puke or vomit. So these becomes the eating disorder. They are malnourished, they are underweight. Still, they think that they are overweight and they will do certain things so that they should not gain weight. Then neurodevelopmental disorders. As the name suggests, it happens during the developmental phase, that is when the child is in the womb. Due to certain factors like toxin exposure, mother is an addict, and many other things genetical, the brain development is not proper. So the child is born with mild to moderate brain retardation. And like we have autism, we have attention deficit disorders, um, and many other such disorders in child, where we in general terms we say mentally retarded child, or the child is not as per the other children of his own age. So that is a neurodevelopmental disorder. It is not fully curable, but with therapy we can make the child live a near normal life. And I am happy to say we are a part of NGO where we provide mental health therapy to such children free of cost, so that they can lead a near normal life. Now coming to neurocognitive disorders. This happens, your cognition, that is your thinking pattern gets affected. It may develop with age or certain conditions, some trauma to brain or something. Then one example is dementia. When as you age, you start forgetting things. You start losing your memory. That is a neurocognitive disorder. Then trauma or stress related disorder. If you have experienced or you have witnessed a trauma which has impacted your brain too much, then you will have a post-traumatic stress disorder, where you have various symptoms. You are not able to sleep properly. You are always thinking about the same situation, and you are very restless. And of course, substance abuse disorders. We have alcohol, tobacco, nicotine, so many things which creates problem in your day-to-day life. Obsessive compulsive disorder. Your obsession for a particular thing makes you to do things compulsory. Like one is very much into cleaning. He sees dirt everywhere. He will keep cleaning, cleaning, cleaning. Every time he'll keep cleaning. So that is your obsession, and it becomes an obsessive compulsive disorder. Then disruptive impulse control and conduct disorder. This is basically in children, where whatever you do, whatever you say, teachers say anything, the child will not listen to anybody. He will misbehave. He will. You cannot put him in order as per the norms of the society. He will do whatever he wants. So whatever you say, whatever the teacher says, He is not going to listen to it, anybody that is conduct disorder. Then schizophrenia and other psychotic disorders. Here you have hallucinations, delusions. You hear things which are not there. You see things which are not there. So that is a type of mental disorder. And there are mental medication induced disorder. There are certain drugs which are taken in excess amount can cause psychosis like symptoms. So we have to take care of that. Now this brings us to what are the causes of mental illnesses. There are biological, psychological, and environmental causes. So biological, we have genetics, brain defects or injury, infections, infections to brain by certain bacteria and viruses, poor nutrition, exposure to toxins, and prenatal damage. See, all the biological causes, if they damage, they cause permanent damage to your brain, then the thing is not 100% curable. But with therapy, you can at least try to lead a normal life. Now, coming to psychological and environmental, we have severe psychological trauma or stress, sexual, physical, emotional abuse, neglect, lack of support from friends and family, family or school violence, poor social relationships, early loss of immediate family member or dear friend, dysfunctional family, death, divorce, social or cultural expectations, change of environment, substance abuse, school work, school bullying, school environment, and romantic failure. All these causes can be taken care of because these are just impacted one thinking pattern of your brain, right? Children who are sexually, mentally, and or emotionally abused during childhood, those who have seen violence in their family, father beating mother, father beating kids, or those who have faced too much of bullying in their school or college life, right? In cultures where the norms of society rules were so strict that they were not able to cope up with it. Then there is divorce of parents. You are staying with one parent. Then if some child who has lost his mother or father at a very early age, all these causes impact some impact on your brain. You may think that you have overcome it, but it is somewhere inside your unconscious mind, and it can manifest as anxiety disorder, as depression in later life. Now, so this brings up to what are the signs and symptoms of mental illness. So, how will you be able to see that yes, I'm suffering from some sort of problem? You're feeling very sad, withdrawn for more than 2 weeks, and you have thoughts of harming yourself or thoughts of harming others. This mainly happens during depression when you want to basically harm yourself. Then severe out of control risk taking behaviors that can cause harm to you or to others. Sudden overwhelming fear for no reason. You're fearful for no reason. And you will have racing heart, physical discomfort, and difficulty in breathing. As I told, this happens during panic disorder. A significant weight loss or weight gain. This can happen in eating disorder and depression. Then seeing, hearing, or believing things that are not real. We have delusions and hallucinations. That is schizophrenia and or psychotic disorder. Excessive use of alcohols or drugs. Alcohols and drugs impair the thinking capacity of the brain. So you end up acting like a psychotic. And drastic changes in your mood, your behavior, your personality, your sleeping habit. You were till now you were normal. You were doing everything good, but suddenly something happened and you suddenly change. You are a completely changed person, right? So that you should take care of. Extremely difficulty in concentrating or staying still. Children with ADHD, they have attention deficit hyperactivity disorder. They will not sit still for 2 minutes at one place. They'll keep running, jumping, or doing things. Then intense worries or fears about your future or anything that hampers your day-to-day activities. You are not able to carry out your life in a normal manner. So this brings us to symptoms. So in gist, what are the symptoms which you should be looking for? Confused thinking, feeling of sadness, suicidal thoughts, withdrawal from friends, excessive worries or fears, major changes in your eating habits, excessive anger, hostility or violence, inability to cope with daily problems or stress, and trouble in understanding things. If you see any of the symptoms persistently for more than 2 weeks, please you consult somebody or you try out activities first to de-stress yourself. In fact, you should try activities to de-stress yourself regularly. Now, before going into relaxation techniques, what activities we can do on our own, I'd like to introduce you to perinatal mental health. So now, what is perinatal period? Perinatal period is from the time a lady conceives, the time she becomes pregnant, 1 year after the birth of the baby. This is the perinatal period. So, perinatal mental health is looking after the mental health of the lady from the time she conceives till 1 year after the birth of the child. Now, why should we talking about this? You will see it in subsequent slides. So, this perinatal mental health includes mental illnesses if the lady was already mentally sick before she conceived, or if she developed some new mental illness during her course of pregnancy or after birth of the child. So, it includes all the illnesses. So, what are the various types of illnesses? Antenatal depression and anxiety, that is during pregnancy. Postnatal depression and anxiety, that is post delivery. Post traumatic stress disorder, bipolar disorders, postpartum psychosis, and recurrence of any other mental illness. So, why this happens to a pregnant lady? Is what's wrong? She was completely normal till now. And what happens that a pregnant lady's mental health has become so important that a perinatal mental health, a new concept is coming up? Because a pregnant lady has many fears. Before that, I'll just want to tell you. During pregnancy, what happens? There is major hormonal and chemical changes in the body of a woman, and it affects her brain also. What happens? She becomes too labile for emotion. She may be a strong, independent woman before pregnancy, but the moment she conceives, she is at heightened emotion. She becomes fearful. Keeps crying for no reason. She just wants to cry. She wants to be dependent on others. She wants to look after. This is not, she is doing it purposely. The hormones and the chemicals are making her do so. So she needs extra care during pregnancy. Not only physical care, mental health, mental care she wants during pregnancy. So what all fears can be? Fear of gaining weight, fear of losing body shape. These are new fears which are coming up in our today's generation because they don't want to gain weight and look ugly, right? Then fear of delivery, of course. You have heard there is too much pain during labor. Even if you go for cesarean, there is pain after cesarean section also. So you have fear of that. Then will you be able to be a good mother? Will you be able to look after your child? What about the finances? And so many things. There is no end to it. You can be fearful of anything. Then social restraints. We pose so many restraints on a pregnant lady. Till now, she was doing everything alone. She was going out whenever she wants to. But now, don't eat this, don't eat that, don't do this, don't do that. So many things. Don't go out at this time. So many things which she may not be able to accept. Sleeplessness, of course, what happens? Because of the growing tummy, which it exerts pressure on your urinary bladder. So what happens? You want to go for frequent urination. So you will not get a proper sleep whole night. You have to get up 2-3 times to go to urine. So that may be frustrating. If mother has certain addictions, then it will become problem for the baby and the mother. Shame if the baby is unwanted, if it is because of a love affair or she was unmarried or it's maybe because of some rape. So there may be shame on carrying the baby. Then changes in role. Till now she was just a wife and daughter-in-law. Now she is going to be a mother, which is a very big responsibility. She has to forget herself to take care of the baby. She has to take care of household. So it may be become worrisome for her. Then, of course, additional burdens like economic burden, health issues. She may get diabetes or hypertension during pregnancy. So she has to take care of it. And of course, there are too many thoughts which I've spoken about. Then unexpected body changes. You have to put on weight during pregnancy. Then relationship with family. Is your husband supportive? Is your family supportive? Is there any domestic violence? It affects the growth of the baby and it affects the mental health of the mother. So there is a term known as pregnancy brain. What happens because of the chemical and hormonal changes? The lady starts forgetting things. She becomes forgetful, and it happens to lot many ladies during pregnancy. Now, why should we talking about perinatal mental health? I want to share certain data with you. This is the data of United Kingdom, which says 20% of women develop mental health problems during pregnancy and 1 year after birth. That is perinatal period. And suicide is the biggest cause of death for women during pregnancy or in perinatal period. Yes, pregnant women do commit suicide. They go so much into depression that they commit suicide. So we need to take care of, because there are two lives. So we have to take care of the mental health. Now this was the data shared in our the NDTV Swasth Banega India in February 24-23, which says that every 2 minutes a woman dies of causes during pregnancy, and the causes are preventable. So we have to take care of pregnant women. We cannot let a woman and a small baby who has not yet born die because of causes which we can control. Now this was the data of, about our country, which was published in Indian Express in May 24. See, in 23-24, within 6 months, we have 279 deaths. Though the number is reducing, but why should a woman die during pregnancy? Is not a disease. So why should she die, right? In our country also, suicide during pregnancy or postpartum period is 7.6%. This is the rate of suicide of a pregnant lady or a new mother, right? So we had to take care of it. Now, what happens if a mother is not emotionally well, mentally healthy? What happens if a mentally ill lady gets pregnant? She will not go for her regular antenatal checkups. She will not take adequate nutrition. So there is risk of preterm birth, low birth weight, and diseases during pregnancy. Now, what happens when she delivers? She will not breastfeed the baby properly. She will not take the care of the nutrition of the baby. So, baby will have risks of mortality, low birth weight, and there will be disruption in the maternal infant bonding. It is very important. If the mother child bond is not formed properly in initial days, this child will have difficulty in bonding with anybody in his entire life. So the mother child bonding is very important. Now as this child grows up, he may have various cognitive problems, he may have low immunization rates, and as this child reaches adolescence, he may have high rates of suicides, depression, anxiety disorder. And again, now this is a mentally ill child. Now again, this child becomes mother or father. The cycle will continue. So this is a vicious cycle which we have to break. Because a mentally ill father or mother will produce a mentally ill or mentally sick child, right? So what all happens in medical terms if we talk about it? During pregnancy, there is miscarriage, preterm birth, and low birth weight. And what happens to the child after he's born? He may develop ADHD, anxiety disorder, depression. He's very prone. This child will be prone to all sort of mental illness, especially anxiety and depression, as he grows up in his life, as he reaches adolescence. Now, of course, talking about father, we don't say to nowadays we don't talk same pregnant woman or lady. We call it pregnant couple. Why? Because father has equal important role in it. But we don't talk about fathers, especially in our country. But data shows that 1 in 10 fathers experience mental health issues after the birth of the child. And this increases to 24 to 50% if the partner, that is mother, is also depressed. Anxiety is more common than depression in fathers. Now, why fathers are anxious or depressed? Because they cannot connect to the child. See, the mother is pregnant, while lady is pregnant, and she can feel the baby inside and she can feel the changes. Father may not be able to connect immediately to the child. Then he may have many issues. He has to thought of finances, how to take care of wife, how to take care of child, how to manage household, how to manage work. Everything the father also has to think. Then there is disequilibrium in relationship. Till now, wife was only wife, and she used to give her time to husband happily. But now she is a mother. She is going to be a mother. She has to give time to the child more than the father. So father may not be able to accept it easily. It may happen. He will be also sleep deprived and exhausted. Baby is crying in the night, getting up and crying in the night. The father also gets sleep deprived. Then of course pulled between demands of work and home. Frustration because of so many things he has to handle all alone. Then if mother is sick, she cannot take care of the child. That time father has to take the role of mother also. Then of course he has to look into finances, and he may feel he is not capable of taking care of the baby as the mother does, right? And of course the relationship with the partner is affected. So why is it so difficult for men to talk about mental health? Even when they are father or they not their father, men has more difficulty in talking about mental health than women because of social norms about masculinity. अरे मर्द को दर्द नहीं होता is the concept. It's a famous movie dialogue and it is ingrained in our mind. मर्द को दर्द नहीं होता. He cannot cry. He cannot express his emotions because मर्द है वो. He's a man, right? So that's why men do not open up. Now, very interesting thing. Then, if father is not carrying the child, how can he affect the mental health of the child? It happens. Studies have proved that if a father is having depression 8 weeks after the birth of the child will have behavioral problems, especially if he's a boy child. Again, another study said that a father who is depressed both during pregnancy and after delivery of the child, his child will have some psychiatric disorder by the age of 7 years. And hyperactivity in boys. Boys who are very hyperactive. And emotional social problems in girls. They are attributable to their father's mental health. So this brings us to treatment. So there are various types of treatments available, like medications. These are mainly for moderate to severe kind of mental health issues. Psychotherapy. Psychotherapy is you are going to a counselor or psychotherapist and you're talking out your heart and they'll give you methods. They will train you how to take care of mental health. And of course, severe cases need hospitalization, and there are alternative therapies which we'll be talking about, which you can do on your own to take care of your mental health. So let's take a break today and let's love ourselves. Let's calm down our mind and take care of our mental health. So how can we do this? First and foremost thing, accept yourself who you are. Don't try to pretend. Don't try to be somebody else. Accept who you are. If you accept yourself, others will accept you and you will be at peace with your mind. Keep active, keep exercising, go out, walk, jog, go to gym, whatever you want, whatever you like. But be active because when you exercise, there are certain release of hormones in your body which will make you happy. Get involved. Get involved with your family, your friends. Go out for movies, go out for picnics, take out time, play with your children. Very important. Play with your children. So you will be happy, your children will be happy. The bonding between the family will be strong. Whatever you do, try to enjoy it. And if you cannot enjoy it, but you have to do it, then accept it and do it with as much ease as you can. Relax. Take small breaks. Go to nature. Just sleep. Just do yoga, meditation, anything. Just try to relax yourself. Go and read books. Do something creative, gardening, painting, anything, whatever you like. Keep in touch with your friends and find out your own way of survival and thrive. Everybody has its own way to do things. Try your own way to survive, don't copy others. Will not be able to do it, right? And after doing everything, if you are not able to take care, if you feel that still you have certain issues, ask for help and go to a therapist and talk about it. Now, what are the various activities which you can do? So exercising, spending time in nature, gardening, journaling, writing. If you are in habit of writing a diary, when you write your mind out in your diary, it empties your mind and it relaxes your mind. So it's very important. You can do that. It will help you in relaxation. And deep breathing, taking hot and cold bath, reading a book, seeing a friend, doing something new. Something new will give you certain sort of excitement, a boost to your mental health. You can play with your pets, you can meditate, you can do art, laughing exercises that you can do, and practice gratitude. Try to thank everybody who has done anything good to you. It will make them and you feel good. Now, there are certain things which you can control, certain things which you cannot control. So, always accept things which you cannot control. Like you cannot control how others feel, how others thought about you. So, you cannot control other people's decisions, thoughts, emotions. So, don't bother much about it. Do what you can control, right? Control yourself, your thoughts, follow a healthy lifestyle, which is good for your physical and mental health. Now we'll just talk about certain relaxation techniques which you can do in your daily life, which will be beneficial for your mental health. First and foremost is deep breathing. Whenever you are in anxiety or stressed out state, just don't react or don't say anything to anybody. Sit down, do deep breathing. It will help you in relaxing and calming down your mind. Then and then, once your mind is calmed down, try to take any action or take any decision. Don't take any decision when you're anxious or stressed out, right? Then there is a thing called guided imagery. What happens if you're stressed out? Do deep breathing, sit down or relax on a couch. Just think of something very good which has happened in your life, or think that you are in a place where you always wanted to be, which gives you happiness. Think what you are doing there, what which you wanted to do every time. So this will help you in relaxing your mind in the heat of the situation, right? And of course, yoga, this can you can start doing daily. It has many benefits to not only to physical health, to mental health. It will alleviate your stress and anxiety level. It will improve your core. It will enhance resilience. It will build resilience. It will help you in improving your memory. It will promote mindfulness. So yoga has many benefits. Now coming to meditation and mindfulness. Meditation, you all know there are various types of meditation which helps in reducing stress. Now what happens when you meditate? The oxygen consumption for your brain increases because you are doing deep breathing. So your parasympathetic nervous system gets stimulated, which stimulates relaxation all over your body and your mind, right? Your adrenal glands which produce cortisol. Cortisol is a stress hormone. It starts producing less cortisol. So your stress automatically reduces. So it is a very important thing. If you meditate daily, it will help you in keeping yourself calm during stressful situations. Then mindfulness. What is mindfulness? Mindfulness simply means stay in present. Don't get stuck in your past or don't think too much about future. Just stay in present. If you're eating, enjoy the color of the food, enjoy the taste of the food, right? Don't think of any other thing or don't do work in your laptop, don't play mobile. Just eat, think, sit quietly and eat your food, right? So this improves your mood, your energy, your awareness, your empathy. It boosts focus. It helps in reducing depression and anxiety, right? Then positive affirmations. You can put a board in front of you where you write whatever positive thoughts you have in your mind for yourself. Read it every morning or whenever you are depressed or stressed out. It will help you in boosting your confidence. Puzzle solving, very important thing. You try to solve puzzles when you are stressed. It will help you in relaxing your mind. And if a mother is doing puzzle solving during pregnancy, the left side of the brain of the baby will develop automatically. Baby will be a genius. Now, reading books. As per psychology, reading is the most important or most significant activity which reduces your stress level by 68%. Read a book, hardcore book, not online. Listening to music, 61%. Drinking tea, 54%. Taking a walk, 42%. And playing video games, 21%. So if you read, your stress will reduce by 68% because it helps you in improving your focus and concentration and gives you time to unwind. And now, if a mother reads to a baby in the womb, what happens? The baby's brain starts developing automatically, and there is the greater mother and child bonding. In fact, fathers can read to the womb, so the father and the child bond will start improving. Now, even after doing everything, if still you feel that you are not able to cope up with your mental illness, please go and talk to a licensed therapist. We in Speakingcube, we have a mission to reach or to make mental health accessible to remote areas. So we have gone online since 2020 and we provide all sorts of mental health services to all the sector from pregnancy till death, right? And we are into academics and research also so that we are training new perinatal mental health therapists and psychologists and psychotherapists who can take care of the society. So these are the various services which are provided by Speakingcube. And we also run a happy pregnancy OPD free of cost every Sunday. It is completely online. This is for the sector, like low income sector where mothers are not able to pay for consultation. We pay them, we give them free of service, free of cost service so that they can be able to take care of their mental health. Of course, we have various certification courses. We conduct various workshops. to enhance the knowledge. We have conducted 5, 6 seminars, international seminars with various international psychologists and communities. And now, in the end, to wind up, why should we talk about mental health? Because we have to break the stigmas associated with it so that we can help others express their emotions, so that people can be solve their problems easily. We have to educate others, and we have to get support for all the members of the society so that people are free to ask help whenever they need. They don't have to think twice before asking help. This will also help in improving relationships. We have having too much relationship issues nowadays, so this will help in that also. Then of course we have to break the stereotypes and make mental health accessible to all. So now I end up with my presentation. So if any questions, I'd like to answer.
Thank you, Anupaji. That was really a wonderful session. I express my gratitude for delivering such a wonderful session and enlightening our students with the knowledge
Thank
about
you.
mental health and especially the perinatal aspects, because yes, that's really true. There is a lot stigma associated with the mental health in the Indian and the Asian population. So, especially the statistics that you have shown were really alarming, and they must have really given a path to think about that. Yes, how best we can improve our future generations and try to improve their mental health. So, the students, you may please post your queries in the chat box. Which medicines can affect the mental
Uh,
health?
there are many sorts of medications. Like there are certain antihypertensives. Like I will give you a very common example. See, diphenhydramine, which is a cough syrup. If it is taken in excessive amount, it can also cause as a symptoms of psychosis. So there are many drugs. There are certain antihypertensive, like these are beta blockers. They can cause psychotic symptoms in certain patients, right? So there is a list of many big list of drugs which can be cause psychotic symptoms in a patient. Um,
What are the
I
signs
think there
of
were
depression
some
in
signs of
pregnancy?
depression. Yes. And during pregnancy also, the woman is feeling very sad. She's crying on small issues. This should persist for more than 2 weeks. She doesn't want to take care of herself. She doesn't want to take care of the baby. She wants to stay alone. She doesn't want to go out. She has some feeling of guilt. She thinks she will not be able to take care of herself, not able to take care of the baby. So she's crying all the time. So that is the main signs of depression during pregnancy. That is not possible. Yeah, see, sometimes what happens, you are depressed during, you may have small episodes of depression during pregnancy, especially if you are facing certain issues. Sometimes what happens, you want to eat in first trimester, you are hungry, you want to eat, but then you have nausea, vomiting. Whatever you eat, you vomit out. So what happens, this can be a cause of depression and sadness in the lady, right? So this is a passing phase. The moment her nausea vomiting stops, she may start eating, and that depression will go. But in certain cases, the lady continues with depression. So we have to find out if that she is continues to depression, and then we have to treat that depression.
How
What
to
is
tackle a kid of 8 years who shows tantrums too much and is very angry?
8-year-old child, then there must be some childhood issues or trauma to the child. We have to talk to the parents and child, and we have to find out that issue, and we have to tackle that issue of the child, right? So then only you can be able to manage the child. There are various therapies for a child. Like there is a award system wherein you tell the child, if you behave in such a manner, we'll give you this, right? So if the child wants that, he will try to improve his behavior. But there is, if he's showing too much of tantrum at the age of 8 years, you need to consider that some sort of abuse has happened during childhood. which we need to find out and sort it out. Uh,
What could be the
okay.
group of foods that are bad or good for mental health?
Okay. Anything which is termed as healthy food, green leafy vegetables, fruits, um, your normal rice, dal, everything is in good category. But whatever we eat, processed food, nowadays pizza, burger, all these are good under bad category for your physical health and for your mental health. Especially addictive foods like alcohol, cocaine, and drugs, other drugs. So we should avoid all those drugs, right? Well, too much of caffeine, too much of coffee is also not good for your mental health. You should avoid anything which is addictive. You should avoid. So what's the next question? How long does grief period last? See, grieve for anything. If you are grieving at the loss of your very near, like your parent or your very near dear one also, it should not last for more than 2 weeks. And at the stretch for more than 1 month. But 2 weeks is enough. After that, you should start uh, coming to your normal life, right? If it's more than 1 month, then you should go and talk to somebody about your grieving. And what is the next question? What can family do to help a pregnant woman who is on bed rest and is depressed if she is unwilling to talk? Yes. Uh, there must be something why she is not willing to talk. Right. In remember, if you want to have a therapy, a good therapy, the patient must be willing to talk. Patient must be willing to take the therapy. If he is not ready, then you have to find out ways why she's not talking. There must be something she's not talking. Maybe she may talk to some therapist because she may not be having good experience with the family members, so she doesn't want to talk to them. So we have to try somebody else whom she can open up, and we have to find out the cause of depression, and we have to tackle it. But if this is not taken care, the baby might have the consequences. So it has to be taken care of. When and what are the alarming signs of grieving? The alarming signs of grieving, it's more than 2 weeks, you are still crying, 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 you're not eating, you are not going out, you're not meeting, or you're not starting your daily routine the way you used to be. You're not started showing that you have coming to your normal life after 2 weeks of grieving. Then you should start thinking of that you are stuck into that grief and you have to come out of that grief. Any relationship with hyperemesis and depression? See, as such, there is no relationship between hyperemesis and depression. But what happens because of hyperemesis, the woman gets frustrated and sad. It's normal. She doesn't want. She cannot eat. She cannot drink. Even she takes a drop of water, she is vomiting out. Right. And with pregnancy, she is already exhausted. So it becomes irritating, and if it continues for 3 long months, sometimes what is in our mind, okay, it will stop after 3 months. But in certain ladies, it continues for 9 months. So of course, they will be having what's sadness or depression that I'm still not able to eat when I have to eat, right? So that can be a cause which we have to take care with medicine. Nothing much we can do about it. How to curb anger issues in mothers when they get physically exhausted with toddlers. I have a toddler, and actually, it's very exhausting. You are sick, you just want to take rest, and he will come and he will jump over you. You have to. Initially, also used to. To be very frank, I went into postpartum psychosis when my child was born. He was premature 7 months. He was born in 7 months, and I had very difficult 2 months initially to take care of him. He was in an ICU for a month on ventilator, everything. So it's actually difficult, but with the help of therapy, I was able to calm down myself. And now I every day I just thank you God for having a healthy baby. And I just remember that, and I don't do any physical harm to my child even if I get exhausted also. And if father can help, it's very good. If other family members can help, the burden on the mother can be taken care of. The next question is symptoms in 7-year-old kid with schizophrenic mother. See, it's not necessary that if a mother is schizophrenic, the child will have schizophrenia, but the chances increases chances increases by 3 to 4 times, right? So just be observant. If your child is having some unusual behavior, he's seeing things which he is not there, he's hearing things which are not there, then you should be worrying about it. But just take care of the child. It's not necessary that he will develop schizophrenia, right? He's prone to develop schizophrenia. Uh, Kindly guide upon handling anger issues to talk. I think I have to take a parenting class also. There are too much questions on toddlers, right? We can do that. The toddlers, if you'll say no for anything, they will throw tantrums. You have to find out ways how to say no to them. That's it. Very good topic. Thank you. I think there are no more questions. Newborns feel angry and sad. Yes, we feel angry and sad because we have no time for self-care. It's right. So how can you take care of that? Please, if you are a father, you take off 1 or 2 days and give the mother rest and take care of the baby. Let her take care of self. Give her self time. It happens in foreign country. It happens. It is known as parents' break. They leave the child to the grandparents and they take 1 or 2 days off and they just go relaxing in there. So in our country, it may not happen 1 or 2 days, but at least give her few hours a day to take care of herself. It actually happens. And ma'am, and what happens initially, we were in joint families. There were so many people to take care of the newborn, so the lady was not exhausted. Now, because of nuclear families, father goes for work, mother is all alone with the baby. She has to do all household work. She'll make the baby sleep. She'll do the household work. Before she finishes, the baby will get up. So where is the time for herself? And I have faced, even I had to go to washroom, I had to take the baby with myself because there was nobody to hold the baby. So it's frustrating. So if you can arrange for some lady at home who can look after the baby for some time, it will be good. It will be helpful for the mother. Any specific mental health exercise which can help person reduce anxiety. Meditation is a very good. Meditation and yoga is very good exercise for all types of mental health problems, stress and anxiety. But if you are still after meditation and yoga, you are not able to handle your anxiety, we have various therapies in our session which you can be taught to tackle your anxiety. But do meditation regularly. What will be the symptoms of if I have done?
I think there are no more questions, but
Mhm.
Anupa ji have very well answered each and every query. And
Thank
I
you,
am
ma'am.
sure that most of the females must have got their answers with what you have explained to them. Specifically, the taking out time for yourself is quite an essential thing,
It is
because being a
essential.
working woman, we have time for our family, we have time for our work, but we miss out on our me time, especially,
Yes,
which
ma'am.
leads
Yes.
to lots and lots of mental problems. So it was really a nice session, and the questions were really interesting. I also thank the audience for being such an active audience. But as we are getting short of time, so we cannot take the questions more. But yes, definitely there we can have the further sessions on the special what we can say is maternal care and the child care.
Yes, ma'am. We
So
should
in
have.
the later, yes, yes. Sure. So let me take the opportunity to thank all of the students and the participants for being such a great audience. Thank you, ma'am, for delivering such a wonderful session. Our director, ma'am Parimala Veluali, who has conceptualized these concepts of Alumina Lecture Series. So I thank a lot for having her support throughout the conduct of the sessions. Our IT team, who has made it possible to connect with all the students and taking the session so seamlessly. And the staff members who have been in the background working exhaustively for the session to go very well. So thank you, all of you. So now we can just request the participants to just turn on the camera so that we can have a group screenshots taken. Just participants turn on the camera.
Madam, it's a webinar.
So we don't
We
have
can
to do
start.
that. We have the list. Okay, that's great. So we can end the session. Thank you so much,
Okay.
ma'am.
Thank you, ma'am.